Hi everybody, this is Douglas Hamandishe. I'm here and honoured to have Geert Bettinger, the author of the book Moving On by Standing Still. So what really inspired you to write this book?
Yes. It has to do with my childhood, of course. As I told you, I was abused, and the abusing for me is not a problem anymore. But at that time, I didn't have words, or I couldn't talk about what was happening when I was 10 years old. So what I showed was so-called problem behavior. I steal and I fight and I was a ref to my parents, etc., etc. So I got a lot of punishment because people in my environment, they think I'm a problem child. But I was not a problem child, but I was a child with a problem. In the first place, I was a child. So, and after that period, when I came in social work and the nursery work, I saw many children, I saw many people, many problem people with problem behavior, and I couldn't stand this way of view, because they, in the first place, they are children, they are persons, they are people, and they give signals, like me. Stealing was not a problem; it was a signal of something deeper, and that's why I insist to. No, it is not insisting. It's my mission to let people see. Please don't judge problem behavior. Don't judge behavior, but try to find out. Try to make contact with the person. What's behind that behavior?
Sure. If you can just talk a little bit more about signaling type behaviors, and how can you identify when somebody's actually signaling something that could be a sign of distress, sign of ongoing or pending psychosis.
Yeah. At that moment, as a care worker or a parent or a teacher or a social worker or a nurse, at the moment you judge the behavior, that for me is a signal to you, wait, something, why do I judge this behavior? That is for me the moment to get more involved, to get more, not involved, get more in contact with the person, because I think that is the most important thing to do.
How can parents allow a child to be themselves instead of trying to conform to the preconceived way of doing things?
What everybody needs, and the child specifically, is needs a very, very safe environment. You know, what happened with me, what happened with many children, that's not a problem, but to keep it inside. So how parents can help the children to create a safe environment. In this house, you can talk about everything. You can talk about all the things you come through the day, the sorrows, the anxiousness. You can talk about everything, and we don't judge. We want to listen.
Within the NHS, within that environment, creating that safe space is a challenge. We have new models of care, new types of wards being built all the time. But the basics in terms of creating a safe environment is making sure that that time you spend with the person in need is protected. You're not distracted with your bleep going off. You're not having distressing images behind you to distract the actual conversation. You actually focused on that individual for that particular period of time.
You're interested in the person?
Indeed, so I think being interested in the person is the fundamental quality in health. I was lucky enough to be trained by some very, I wouldn't say revolutionary, but very forward-thinking practitioners who basically told me it's okay to postpone or to continue a conversation the next time you're on shift, opposed to rushing a difficult conversation. It's important to discuss through with the patient, acknowledging their difficulties, and then agreeing to meet at another time. And that also gives the individual time to prepare for that conversations, because I think as professionals we risk always automatically assuming that somebody is prepared to engage and have a conversation with us just because we have knocked on their door, or just because they're in a hospital environment.
Is that the way you wanted to be treated also? But as a person,
Indeed, so for me, it's fundamental. If somebody is not interested in me,
okay,
I will not be interested in you.
beautiful. You agree with me or not? I don't know. The client is also a kind of professional.
Indeed, so the way I've always looked at it is, if you take the old propeller planes that have two engines on either side of the wing, this is how all health services should be built upon. You can fly a plane with one engine, but you bank heavily to one side, and eventually you will get yourself into a spin and crash.
Beautiful metaphor.
Okay, you need both those engines firing and working in collaboration with each other. You know, so you have one person who's expert based upon their lived experience, giving the respect to that lived experience. And you have the healthcare professional who is an expert based upon the academia.
How do we reflect? And I think the education, the nursery education, social work education, psychology education, more reflection. Why do I like I do? And that is why I wrote this book, because reflection gives you a mirror to yourself. And the best mirror is mostly the client, if you are open for that. The client, for me, is the best mirror I could get. And if you want to look in my mirror, if you want to look in my life, I'm sure you can help me in a very good way.
Sure. Within the UK NHS service now, we're trying to integrate our care. So it's care outside the boundaries of a hospital. So by that we mean integrating teams with community services, social work, schools, all coming together.
Yes.
Is there any advice of how these integrated teams should work in supporting an individual going through crisis?
I worked in that team. I coached that teams also. That in the Netherlands you have several teams in the neighborhoods. There is one danger in that, because when you put 6 or 7 professionals together around one table, they are more and more talking about the person they want to care of. For me, the advice is sometimes introduce the person in that communication, and not talking about talking with, because 6 or 7 professionals together, you know what can happen.
Sure.
Who's the best professional?
Yes. Another question is, what then do you say to a healthcare professional that doesn't fully understand or doesn't fully embrace the power of recovery and patient-centered type of care? What do you say?
Maybe ask more to the professional. Well, what do you think the client wants you to help with? And did you ask the client, is this the way you want to be helped? Is this the answer you want to get from me? That could be a way. More equally. And maybe you ask the client, what do you want to know about me?
So you bring it back.
Yes. What do you know about me?
Also, what's your views on technology?
Contact for me is the most important. It's basic to try to help people and to try to be involved in the problems of people.
Sure. No, that's a good answer. I think that the quality of the engagement
For me, it's really important.
For individuals that are going through crisis, again, there's a toolkit of ways of communicating.
Of course.
You have to pick the right tool that's good for yourself.
Personal.
I think as services evolve, we have to marry and match the demands of our customers, service users, patients. There's still a lot of work that needs to be done in that arena. So I would like to close in thanking Geert to coming over to my humble abode.
Yes.
Humble abode.
New word I learned.
Again, anybody that's going through psychosis, any mental health problems at all, even challenging situations in terms of behaviour, if you're looking after somebody that's going through some sort of crisis, I cannot guarantee enough this book by Geert Bettinger, Moving On by Standing Still, being able to embrace silence and watching things unfold and not prejudging, being humanistic, collaborative, all these things that are talked about in this book in a very accessible way.
Thank you, Douglas.
Thank you very much. Thank you very much. Thank you.